September is Suicide Awareness Month. On average, 3 Tennesseans and 4 Georgians die by suicide each day. Thanks for joining us. I'm Greg Glover.
And I'm Latrice Curry. Channel 3's Allison Pryor tells us the goal of this month is to try and start conversations that help erase the stigmas attached to mental illness.
The most recent year of available statistics was 2018, in which 48,344 Americans died by suicide, making it the 10th leading cause of death in the U.S. The goal of the Prevention Week is to raise awareness, share resources, and start conversations so people feel comfortable talking about mental health. The Tennessee Suicide Prevention Network is a statewide organization that does this outreach work year-round.
Make sure that as many people who are struggling and may be thinking of suicide and thinking about ending their life are able to get the help that they need to get better.
If you or someone you know is having a mental health crisis, there is help and hope.
So I lost my brother to suicide in 2003. And especially the last several years, that's what's driven me to really get involved and to do what I can in suicide prevention, especially being in healthcare.
She is trained in QPR. It's like CPR, but for mental health.
It teaches you not to be afraid to ask someone, are you thinking of harming yourself? Are you thinking of killing yourself? I mean, you come right out and you should just ask.
The direct, open conversation will make them more likely to talk to you. Also, a good tool is to make a safety plan.
If you know that you struggle with your mental health, pre-pandemic, and you know that, hey, going into the winter months is harder for me, that's really knowledge that is powerful.
Put the safety plan together when in a good mental state. It should include what your mental health symptoms look like, people to reach out to, activities to do, and crisis phone numbers. It will take a while to understand the true impact of the coronavirus pandemic.
But preliminary data is showing us that thankfully we are not seeing an increase in suicide. So that is a positive thing. That means that, potentially if more people are struggling, they're reaching out.
Both Christy and Rachel want mental health to be normal to talk about.
And so if I can help another family get their loved one that help, then I feel like I've done my job. It helps me. It makes me happy to do this work because I feel like it makes his memory live on.
If you're interested in becoming QPR trained, there are free Zoom trainings through the Tennessee Suicide Prevention Network. We have a link to that as well as resources for anyone who needs help inside the WRCB app and on our website. Reporting in Hamilton County, Allison Pryor, Channel 3 Eyewitness News.